I'm Lauren Solomon. Welcome to Around the Valley. Today I'm here with Dr. Connor Telles, who is a spine surgeon with a new surgical procedure. He works right here in Fresno with us. Welcome. Thanks for being on the show today.
Thank you for having me.
Of course. So first of all, tell us about your background and your education.
So actually from Fresno, born and raised, went away to college at Dartmouth, studied engineering, then med school and residency at Yale, orthopedic residency, and spine surgery fellowship at Stanford, and then came back to Fresno for a job here at Sierra Pacific Orthopedics.
Wow. Very impressive. And how long have you been a spine surgeon?
Practicing in Fresno for 3 years, training 6 years prior to that.
And I know that there's a new surgical procedure you're doing. Can you tell us about that and how it works?
So we've adapted the way we do spinal fusions. The techniques are constantly evolving, and I'm applying a minimally invasive technique to bigger surgeries. So basically applying minimally invasive principles to larger and more complex operations.
Okay. So how is it more minimally invasive?
So minimally invasive is hard to define, but I would say less blood loss, smaller incisions, less extensive exposure, so less tissue disruption to achieve the same goals.
Okay. So how is this procedure different than from a normal spinal surgery?
So this is an adaptation of a normal spinal fusion, which is one of our most common procedures, and it's different in that the trajectory of the screws and the size of screws is different. So it allows you to stabilize the spine, rods and screws as part of a spinal fusion without the same, it's hard to explain, but without the same exposure. So because of the angle and the size of the screws and the way they're put in, it allows you to stabilize the spine, perform a fusion with less destruction, I guess you could say.
Yeah. I know that there's other doctors who are learning the surgery from you. Are they excited about this?
So there's several doctors in the country, a few in California, who do this type of spinal fusion. There's pockets throughout the country, and then in Europe, there's this is actually a technique that's not that practiced, and I have a guest here today, a surgeon from France. We'd met through some educational activities that we're doing, and he's been observing for 2 days and hopefully going to take some of this back home with him.
Awesome. And we'll ask him a few questions coming up here too. So how has this procedure been beneficial to your patients?
So I think it allows me to operate on people that I might not have been able to operate on otherwise. Patients' baseline health, their size, their bone quality. This kind of allows you to perform a fusion surgery in a patient who's osteoporotic, or maybe an older patient, or a patient who I'm concerned about being in the operating room for too long or doing too much. So through a less invasive approach, it allows you to get the job done.
Is this covered by traditional insurance?
So this is a standard procedure from an insurance standpoint. So it's a part of a laminectomy and fusion. This is covered by Medicare. It's covered by private insurance, covered by workers' comp. So this is not an experimental procedure. This is an adaptation of what we already do through a different approach and a different technique.
And how about healing? I'd imagine it depends on how long the procedure took, as far as like how long it takes to heal.
So healing is somewhat patient dependent based on their age, based on their bone quality and their medical issues. In general, I restrict people after surgery for up to 3 months, no heavy lifting, bending, twisting. That's to allow for the bone to heal during a spinal fusion. A total recovery can be up to a year. People are usually up and walking the next day. However, when I tell them they're recovering, no heavy lifting, bending, twisting for 3 months, that's not no activity. So they're often up walking, even less pain after surgery than before surgery.
Okay. And real quickly, where are you located, and where can people reach out for assistance?
So I'm at Sierra Pacific Orthopedics, a multi-specialty orthopedic group. There's 3 spine surgeons in our group. There's myself, another orthopedic surgeon, and a neurosurgeon.
Well, thank you so much for being with us today. We really appreciate it. I'm here with Dr. Vassal, who is here in Fresno learning the new spinal surgical procedure. Tell us where you're from.
Yeah, hello. I'm from south of France, in Montpellier.
And are you excited to be here?
Yeah. It's my first time in US, so I'm so excited.
Wow.
Yeah.
Wow, that's very exciting. And what do you think of the facilities here?
Yeah, it's great. There is a big hospital with a lot of performance people and technology. It's awesome.
Are the people being good to you?
Yeah.
And what do you think about this new surgical procedure?
It's a very interesting new procedure, minimal invasive, and it can be adapted for all people or for some revision. So it's not so developed in France. So it's very important in my mind, to see it today.
Okay. Well, thank you so much for being with us today. We appreciate it.
Thank you.
Thanks for watching Around the Valley.